Hey everyone, this is Daily Dose of Medicine. Today we will talk about Rosuvastatin. It's a medication commonly known by the brand name Crestor. It's a statin medication used primarily to manage cholesterol levels and reduce heart attack risk, cardiovascular risk. Its mechanism of action is competitive inhibition of an enzyme called HMG-CoA reductase, which is a rate-limiting enzyme in hepatic liver cholesterol synthesis. This inhibition upregulates hepatic LDL receptors, increasing clearance of LDL cholesterol, which is usually known as bad cholesterol from plasma, and reducing the total and LDL cholesterol levels. Also, it's known that it increases HDL, which is known as good cholesterol, and reduces triglycerides. Clinical trials have demonstrated it slows progression and may induce regression of atherosclerosis and reduces cardiovascular events. It's available in 5 milligram, 10 milligram, 20 milligram, and 40 milligram tablets or capsules. Dose adjustments are recommended in Asian patients and those with severe renal impairment due to increased systemic exposure. Common side effects we might see with rosuvastatin includes headache, muscle pain or weakness, abdominal pain, nausea, constipation. Some less common but serious side effects include rhabdomyolysis, which is muscle breakdown, liver damage, memory loss or confusion, new onset diabetes. Avoid rosuvastatin if you have active liver disease, are pregnant or breastfeeding, have severe kidney impairment, and if you're allergic to rosuvastatin or its components. Use with caution in elderly patients, those with thyroid disorders, alcohol use, or Asian ancestry. And that was all. Thank you so much for watching this video. Don't forget to watch our other videos I'll be putting on the screen, and don't forget to join our channel membership. That helps a lot, and I'll see you